Welcome back to From Fear to Fun, the podcast where we explore how to transform medical encounters with children from moments of fear into opportunities for fun, with connection, confidence, and cooperation. I'm so glad that you are here. Today we explore why acknowledging medical belief system is essential for trust, cooperation, and effective care, and how to navigate the delicate moment when beliefs and facts collide. Everybody comes with belief system. Every child, every parent, every clinician walks into the consultation room carrying invisible filters. These are mental shortcuts that help us make sense of the world. These filters shape how we interpret symptoms, advice, behavior, and risk. And they also shape how we communicate. As I have said in one of my earlier episodes, we all walk through life with perception filters. These filters simplify complexity, help us make quick decisions, protect us emotionally, and guide our expectations. But they also create unconscious bias, which can complicate communication between healthcare providers and families. Troubles arise when we remain unaware of each other's belief system. We might encounter less trouble when our belief systems overlap, but on the other hand, we might encounter big trouble when our belief system differ significantly. Understanding this dynamic is the foundation for respectful, effective care. The most common scenario is when belief systems remain unspoken. We assume that the other person sees the world similarly enough to us so that our words will land as intended. We rarely pause to check whether our assumptions match theirs. But in healthcare, this can be tricky. Parents may behave in ways that seem confusing until we understand the beliefs behind them. To uncover these beliefs, we need connection, respect, and psychological safety. Only then will families share what they truly think, especially when their beliefs diverge from ours. Sometimes the family's assumptions are factually correct. In these moments, we can affirm their understanding. This increases their status, strengthens trust, and reinforces the sense that we are working together. Alignment is easy. The challenge lies elsewhere. A situation might arise when belief systems clash. Even so, we must acknowledge medical belief systems. Sometimes the parents or children hold assumptions that are simply wrong. Ignoring these errors risks poor outcome, unnecessary fear, ineffective treatment, and loss of trust later. But correcting someone's belief is delicate. Nobody enjoys being told that they are mistaken. This is where cognitive dissonance appears, the discomfort that arises when facts and beliefs collide. It is painful, and people instinctively defend their beliefs to reduce that discomfort. Our task is to navigate this moment without damaging the relationship. Nevertheless, we must acknowledge medical belief systems. But acknowledgement is not agreement. We can say, "Oh, I see where your opinion comes from." This validates the emotional experience behind the belief without endorsing the incorrect conclusion. Families are often trying to make sense of an emotionally challenging situation. Their interpretations may be wrong, but their need to understand is real. To correct misconceptions safely, two conditions must be already in place. We have connected, and we have established mutual respect. Only then can we gently introduce new information, correct misunderstandings, and guide them towards a more accurate understanding. This is not optional. It is part of our job as healthcare providers. What this sounds like in practice. A respectful correction might sound like, Oh, I understand why you might think that. Many parents wonder the same. Let me show you what actually is happening. Or, yeah, that's a common belief and it makes sense emotionally, but here's what we know medically. This approach acknowledges their belief, protects their dignity, reduces defensiveness, and opens the door to learning. It keeps the relationship intact while we still provide accurate medical guidance. In a nutshell, we must acknowledge medical belief systems, and in a conversation where connection and mutual respect are established, we may need to gently rectify wrong assumptions. This is how we protect trust while guiding families towards accurate understanding. Thanks for listening to From Fear to Fun. Next time, we will look how we can empower the patient and their parents in a very meaningful way. Until then, remain curious, offer connection, and keep moving from fear to fun.